Much, ma'am, for having you. You may proceed with your lecture, ma'am.
Okay, thank you so much. Good morning, everyone. So, as Sir have said, I used to talk about mental health. So I will now again be talking about mental health. Let me share my screen. Okay, is my screen visible?
Yes, ma'am.
Okay,
Perfect.
okay, great. So the topic that I'll be talking about is going to be on mental health. So it will be a basic awareness about mental health. We'll not be digging on the complicated terms, but we'll be talking about mental health in general, what mental illnesses, mental disorders are. And I'll also be covering a little bit on the topic of stress, and we can have a small activity that we can do together. So, first of all, I am sure all of us at this age are aware of mental health. Let's look at a small definition of mental health. Mental health refers to an individual's emotional, psychological, and social well-being. It influences how people think, feel, and behave in daily life. It also affects decision making, stress management, and relationships. So according to the World Health Organization, mental health is a state of mental well-being that enables people to cope with the stresses of life. So it's not saying that helps people not to have any stress in life, but it says that enables people to cope with stresses of life, realize their abilities, learn well and work well, and contribute to their community. So, being mentally healthy does not mean the absence of illness, and this is very, very important. A person can be having illness, physical illness, but can be mentally healthy at the same time. So, instead, it is characterized by the ability to learn, the ability to grow as a person, to feel, express, and manage a range of positive as well as negative emotions. Also, the ability to form and maintain good relationship with others, the ability to cope with and manage change and uncertainty. So when we talk about mental health, it doesn't talk about one individual, although that is also important. It also talks about our relationship with other people. So a mentally healthy person can think clearly, enjoy good relationship with others, can cope with the normal stresses of life and solve problems, and can work productively and make contributions to the community. So, uh, when we look at recent research, it has shown a lot of priority, or as I would put it, it has shown that um, our relationship with our interpersonal relationships, our relationship with our community, with our environment is extremely important for the mental health outcome. So research have shown the contribution of our relationship with others as very important. So, of course, all of us will have our struggles from time to time, but good mental health helps us bounce back and stay in control. So, a person who has resilience means a person has good mental health. So, being in a state of good mental health allows us to maintain healthy relationships as well as our physical well being. Also, we make solid life choices that are for the betterment of ourselves and the people around us. So that is the conceptual framework of mental health. So when we talk about, because nowadays mental health has become a priority, the government of India has given a lot of priority to mental health. Even in academic institutions, a topic of mental health has to be considered when given training. So why is mental health so important? So one of the major mental health is extremely important in the sense that everything we do as human beings, every action, they start with a thought. So it starts over here, stimuli from our sense organs enters our brain, and depending on what type of stimuli it enters, the particular area that is involved in that particular stimuli, and then every action, it begins with a thought. So you started thinking about it, and then once you start thinking about it, excuse me, leads to feelings, and then to actions, and then to results or behavior. So therefore, since everything starts with a thought, our mental well-being is extremely important. So if, say, you're the type of person who thinks about things in a negative way, then the outcome, your actions and your feelings will be determined by the negative thoughts. So therefore, mental health is extremely important. It affects how we think, feel, and act. Mental health is a basic human right. So when we think about rights, I don't think mental health is would be considered a human right. We don't usually think about it that way, but nowadays so much priority has been given to mental health because it has been understood that it has a lot of effect on our overall well-being and overall quality of life. So it is a basic human right, and it is crucial to personal, community, and socio-economic development. It also helps determine how we handle stress, relate to others, and make choices. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world that we live in. So therefore, at the very basic level, it is very extremely important to have mental health. So and also positive mental health allows people to feel good, think clearly, make good choices, again, cope with the stresses of life. And why we keep on talking again and again about stresses of life, coping with the stresses of life, I'll be talking a little about stress later on, is because all of us experience stress one way or another. We experience stress every day in our life, and those who have good mental health, they are able to bounce back from these stressful situations. Some stresses may be very difficult, some may be more easier to handle, but nonetheless, some people are not able to bounce back from these situations because of their mental health conditions. So therefore, one indicator of good mental health is the ability to cope with stress, work productively, be physically healthy, have good relationship with others, make meaningful contributions to the community, and it also helps us to realize our full potential. So, when we talk about mental health, we know that it's all affecting us. We know that it applies to all of us, but sometimes we do not give it a priority. Even in our personal lives, we have so many things to do. Therefore, career becomes more important than our mental health. So, if we have to choose between things, then we usually don't choose our mental health. But why should we care about mental health? Why is it an issue in today's world? So globally, the prevalence of mental disorder in 2009 was 970 million, and in 2003 it have come up to more than 1 billion. So many people all around the world are suffering from mental health disorders. Let's look at the scenario of India. Close to 60 to 70 million people in India suffer from common and severe mental disorders. So when we talk about mental disorders, we're not just talking about the severe mental disorders, but we're also talking about the more common disorders that we see in our everyday life, like anxiety, even stress. So things like that. WHO estimated the burden of mental health problems in India is 2,443 disability adjusted life years per 10,000 population. So the age adjusted suicide rate per 1 lakh population is 21.1, and the economic loss due to mental health conditions between 2012 to 2013 is estimated at 1.03 trillion US dollars. So that's a lot. And the National Mental Health Survey between 2015 to 16 found that 10.6% of adults in India suffer from mental disorders, and that is likely to have increased over the years. The lifetime prevalence of mental disorder in India is 13.7%. National studies reveal that 15% of India's adult population experiences mental health issues that requires intervention. But looking at the case, so there is a large prevalence of mental disorder in India, but let's look at the treatment gap. 70% to 92% of people with mental disorders do not receive proper treatment due to lack of awareness, stigma, shortage of professionals, and lack of access to care all over India. So according to the Indian Journal of Psychiatry, India has 0.75 psychiatrists per 1 lakh people, whereas the WHO has recommended at least 3 per 1 lakh. So even we are in shortage of awareness, we are in shortage of services, we are in shortage of professionals. So, so when we talk about mental health, we have just looked at the scenario of India. We can see that we have very, very high prevalence of mental health disorders in India. Uh, in terms of economy, also it has affected economy as well. So, if you think about it, why is there so much mental health problems? Why is there so much uh, high prevalence of mental health problems, but then we have so many people who are not seeking care, so many people who do not have access to mental health facilities. So one of the major factor contributing to access of care is the myths and misconceptions that we have about mental health. uh, so if we see people having cancer, then we say, okay, you have cancer, that is a terrible news. What are the treatments available? And then nobody would be ashamed to go to the doctor to treat their cancer, right? In fact, it would be thought of as a norm to go to consult a doctor when having some physical illnesses. But when we look at mental illness, uh, we we label it as a we have so much stigma against it that many of us are reluctant to visit a professional regarding mental health issues. And even if we are having mental health issues, we think of ourselves as having some mm, problems that is untreatable. So I want to talk a little bit about the myths and misconceptions that we have about mental health, and see if we are guilty of it. So some people think that mental illness is caused by evil spirit or supernatural power. Uh, in the olden days, especially people who had mental health problems, mental illnesses, some of them were assumed to be possessed by demons, and therefore they were burnt alive. They were put in shackles in prisons, etc. And some people think mental illness are untreatable, but they are in fact very treatable. People think a mental illness isn't real and that it's all in someone's head. But mental illnesses are actually can actually be diagnosed and can be considered a disease and illness. They are full-fledged illness, as similar to physical illness. Therapy and medication are usually considered to be quick fixes, meaning when you have a headache, then you take a medicine and you tend to feel better. So therapy and medications are considered to be quick fixes like that, but they are not usually quick fixes. Rather, they usually take time. Therefore, we have a lot of dropout rates in therapy and mental health interventions. People with mental illness can never be productive or do normal work like normal people. Uh, but in fact, there are many people with mental illness that can be very productive, that are very smart, that are very intelligent. Some people think people with mental illness are violent or dangerous, which is not always the case. Some people think you can always tell if someone has mental illness, but sometimes they are hidden. Some people think mental illness is a sign of weakness or poor character. We tend to think that a person who has mental illness has weak character. They are a bit fragile and sensitive, so they are more prone to having mental illness. But that's not the case. In fact, mental illness, mental disorders, and mental health conditions can happen to anyone. Some people think mental illness can be cured just by thinking positively, and that is not always the case. Some people think only adults experience mental health issues, but we have seen many cases of children having depression as young as 5 years. So we have many cases of mental health issues in among younger populations as well. Some people think mental illness are contagious, which they are not. Of course, there can be genetic involved, but apart from that, they are not contagious. Some people think mental violent and dangerous. I have mentioned this. Some people think people with mental health conditions will never get better, but there are a lot of treatment that can be availed that can help a person in getting better. So these are the common myths. Of course, they are not limited to these. So a lot of these misconceptions uh, have stand in the way for people seeking treatment. Uh, Mental health seeking behavior has been reduced immensely because of these many of these myths and misconceptions that we have about mental health. So, throughout our lives, multiple individual, social, and structural determinants may combine to protect or undermine our mental health. Although most people are remarkably resilient, people who are exposed to unfavorable circumstances, including poverty, violence, inequality, they can be at higher risk of experiencing mental health conditions. So, I'll be talking about the protective and risk factors for mental health conditions. Most people do not develop a mental health condition despite exposure to risk factors, and many people with no known risk factors still develop mental health conditions. So, therefore, it can happen to anyone. Mental health risks and protective factors can be found in society at different scales, can be seen in families, can be seen in individual quality as well. Risks can manifest themselves at all stages of life, but those that occur during developmentally sensitive periods, especially early childhood, can be particularly detrimental. For example, harsh parenting, physical punishment is known to undermine child health, and bullying is considered to be a leading risk factor for mental health conditions. So these can be risk factors for mental health, mental illness outcome. Protective factors similarly occur throughout our lives and serve to strengthen resilience. Protective factors can include our individual and social emotional skills and attributes, as well as positive social interactions that we have in our community, quality education, decent work, safe neighborhoods, community cohesion, among many other things. So, let's look at some other protective factors. So, protective factors are the ones that protect us from developing mental illness, and risk factors are the ones that put us at risk of developing mental illness. So, at the individual level, we have genetic factors, social and emotional skills, sense of self worth and mastery, good physical health, physical activity, etc. At the family and community level, we have good perinatal nutrition is extremely important, good parenting, physical security and safety, positive social networks, green spaces, and we also have at the structure level economic security, good quality infrastructure, equal access to services, quality natural environment, social justice and integration, income and social protection, social and gender equality, among many other things. So protective factors can also be a person's maybe if a person does not have any protective factor in within the environment also, it can be the quality of an individual. It can be a person could be born with resilience, could be born with having self-efficacy, uh, and even good temperament. These are good qualities that can self-esteem, uh, types of personality. All of these psychological factors can also be responsible, can act as a protective factor for an individual. And I also want to add that a person does not need a lot of protective factors to have good mental health outcome, and I assume that most of the participants are teachers, so a teacher can also be a protective factor. If someone does comes from a very negative background, broken background, lots of abuse history, poverty, so all the risk factors that I'll be talking about. So even when they come from that type of environment, if they have just one protective factor, then that can go a long way for the mental health outcome of the person. So I used to say as a teacher, you can be that protective factor. A person needs, even if a person have just one protective factor, then that makes a lot of difference in a person's life. It could even be a neighbor or an old auntie, so if you have that one support system, then they can go a long way in uh, protecting you from risk factors. So let's look at some of the risk factors for mental health disorders. Again, genetic, like a person could have impulsive impulsive personality from the parents, genetically transmitted. So people who are more impulsive have higher chances of having substance use disorder. Not that everyone who is impulsive ends up having substance use disorder, but they are at greater risk. Low education, alcohol and drug abuse by the person or within the family and or immediate environment, unhealthy diet, obesity, chronic disease, vitamin D deficiency, body dissatisfaction, sleep disturbance, and many others. Also, social factors like sexual abuse and violence, emotional and physical abuse and neglect, substance use by mother during pregnancy, bullying, intimate partner violence, being a war veteran, sudden loss of a loved one, job strain, etc. Climate crisis, poor access to services, socioeconomic and gender inequalities, conflict and forced displacement, etc. So these many of these things and many more can contribute as risk factors for a person developing mental illness. So when individual vulnerabilities interact with stressors, they can lead to mental health conditions. If you take a look at this chart, you can see that if the stresses increases and if they have higher risk, then they have higher risk of mental health conditions. But if they have a person, even with a person who have high risk, if they have low stress, they have lower risk of having mental health conditions. But if a person have high risk, high vulnerability, we were talking about the risk. So if they have very high risk here, as many of the risks that we have mentioned here, and they have high stressors in their life, then they have higher chances of having mental health problems in the future. So, but as I have said, not everyone who have risk end up having mental health conditions, and people who do not have any known risk can also develop mental health conditions. So also genetics, when we talk about genetics, chemicals in the body, we have many neurotransmitters which are important for our normal functioning. So sometimes some neurotransmitter may be imbalanced and therefore it can cause some mental health or psychological disorders as well. So therefore those things a person cannot control. They are very similar, they are similar to physical illnesses and has to be treated with medicine. So we have talked about the importance of mental health, what are the risk and protective factors. So now let's dive a little bit into what mental illnesses are. Mental illness refers to a wide range of mental health conditions that affect a person's thinking, feeling, behavior, or mood over a long period of time. So mental health is more than just the absence of mental disorders. It exists on a complex continuum. So it is not whether it is not mental health is not usually considered as there or not there, but rather as a continuum in which a person can fall into anywhere in the line of the continuum. It is experienced differently from one person to the next with varying degrees of difficulty and distress and potentially very different social and clinical outcomes. So there is a lot of individual differences. So mental health conditions include mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. So people with mental health conditions are more likely to experience lower levels of mental well-being, but this is not always or necessarily the case. So here are many different kinds of there are many different kinds of psychological disorders. Here are some given by the DSM-5, uh, but not all mental health conditions, as I have talked about, falls under these diagnostic criteria. So some are more general and more common mental health problems. Some are more severe. So it varies. These mental health disorders varies a lot in the population, and we have a high rate of depression in. I think depression has the prevalence of depression is the highest among mental illnesses in India. So We have talked about what mental health is. We have talked about the protective and risk factors for mental health. We've talked about what mental illness is. So let's look at what are the factors that influence our mental health. So mental health problems can have a wide range of causes, and some of them I have talked about under the protective and risk factors. It's likely that for many people there is a complicated combination of factors, although different people may be more deeply affected by certain things than others. So mental health can be caused by, as I have said, mental illness can be caused by biological factors like chemical imbalance in the brain. mm, there can be low neurotransmitters, supply of neurotransmitters in the brain, and therefore it may lead to resulting psychological disorders. It could be genetics. It could be because of brain trauma or brain injury. Could be because of chronic illness, and it could even be because of the result of medications that have been taken. But we used to say that mental under psychology is biological psychology, especially is the relationship between the brain and behavior. So in psychology and in mental health, we talk a lot about the relationship between the brain and and behavior, and we say that they are connected, but the connection is reciprocal in the sense that the brain influences behavior and behavior also in turn influences the brain. So therefore psychological factors like poor self-esteem, negative thinking, if you are so used to negative thinking, if you tend to think of things negatively, then that can also in reverse impact the chemical balances in your brain as well. So they are reciprocal, they have reciprocal relationships. It's not always that the chemicals in my body is imbalance and therefore it is because of this that I'm having a mental disorder. It could also be because of your psychological habits, the way that you look at life, the way you think about life. And also adverse events in childhood like violence and abuse, emotional neglect, death of a parent. So and many other things, traumatic events can put a person at risk and eventually develop mental health disorders. Social factors like family conflict, poverty, unemployment, poor housing, infertility, and many other things can also be responsible for causing mental illness. So when we talk about the factors that influence mental health, there is no single cause. It's usually a combination of different factors, and uh, not, and we cannot attribute the cause of the mental health to one solid factor. So it could be a combination of stressful life events. It could be biological factors. Maybe they have already been at risk, and then sudden loss of their father, a sudden loss of a family member could be exacerbating the vulnerability. Also individual psychological factors, like if you are, I used to tell my students a lot, like how we tend to perceive things and how we interpret things are also extremely important in life. Although life is not just about thinking positively, but that also plays a major role in the sense that how you choose to think is going to automatically influence the connections in your brain, the neural connections in your brain. So therefore, it's very important to choose positive thinking. It's important to interpret things uh, positively. And okay, as I have said, so it can be a combination of different factors, and these combinations can cause mental health disorders. Also, what I want to add is there's a vicious cycle between poverty and mental ill health. Uh, so it exacerbates mental health conditions a lot. Say a person does not has come from a very low socioeconomic background and therefore does not have good education. So therefore, poor educational attainment ultimately leads to school failure, and then uh, further leads to domestic and interpersonal violence. And then it does not have good education, leading to reduced livelihoods, leading to mental health conditions, and then to substance abuse, risk-taking behaviors, poor parenting. So it is like a vicious cycle that never ends unless the cycle is broken. So therefore, mental health conditions, mental ill health are especially, the prevalence is especially high among mm, people who are living in poverty. So they can't seem to be breaking out of the cycle. So that is one major problem the world is facing right now. So some key facts that we need to know about mental health disorder, it can affect anyone, can affect men, women, rich, poor, children. So anyone can be affected. They don't always look different from others, range from common to severe conditions. And mental health can be common to severe, and it is more than just stress. It can be for a brief period of time, or it can also be for long term. It affects quality of life, work, relationship with others, productivity, uh, and it also effects of stress on entire family. But there are effective forms of treatment, and treatments are available. Uh, just okay. So it can be chronic if it is left untreated. So there are many effective, safe, and affordable treatments for mental health disorders, and these treatments are usually disorder specific, and personalized treatments are usually given. So in Mizoram also we have Kulikon psychiatric ward that caters to general population. We have a lot of psychiatrists, doctors who are having private clinics as well. Civil hospital we have there as well. So in all hospitals we have psychiatrists sitting there, and we also have clinical psychologists. So these services can be availed without any cost in these institutions. So let me go back a little bit to the early warning signs. And of course, the early warning signs of mental illness are not limited to these, but these are some popular signs that we can pick up. Uh, Experiencing one or more of the following feelings or behaviors can be an early warning sign of a problem. So it doesn't always end up being a mental illness, but it can be an early warning sign. So, eating or sleeping too much or too little, inability to sleep because you are under severe stress, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling usually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things are not true, thinking of harming yourself or others, inability to perform daily tasks like taking care of your kids or getting to work or school. So the some things that have been possible to do for a person before, but that suddenly becomes very difficult to do in at the present moment. These can also be indicators of early warning signs of mental health disorders. So we ourselves might not be having mental health problems, but people that we know may be struggling with mental health problems. So it is our duty as teachers, as fellow human beings, to uh, to give awareness to people that there are services that are available, and mental health problems can get better in time if they get the right treatment at the right time. So how, so we have talked a lot about the different signs of mental illness. We've talked about what mental illness, all we've talked about what mental health is. So now focus a little bit on the intervention. So when we talk about mental health intervention, some of them can be medications, some of them can be therapy, full-fledged therapy, and some of them can be normal things that we can do in our everyday life. Simple things, but that makes a lot of difference. So when we talk about physical illness, unless we take medicine, we feel that it's not going to get better. So we need to take medicine, and once we take medicine, then that medicine started working in our body, and we start feeling better. So with mental health, sometimes we assume that. Uh, we need strong medications to get better. So depending on the cases, in severe cases, of course, the medications are required, hospitalizations may be required. But in general, everyday life, there are things that we can do as human beings that can help in for us to maintain good mental health. And these are very, very simple steps, and they are often overlooked. So I just want to mention a few of them before we move into the topic of stress. So, simple ways in which you can maintain good mental health. Uh, you can start talking about your feelings, and if you don't want to talk about your feelings, then you can maybe write them down. Eating healthy is extremely important. Exercise is a great is something. It's for exercise is really really effective in uh, against stressful situations, against mental health illness. Get enough sleep, take care of your personal hygiene, plenty of sunlight, value yourself here, stay positive, mindfulness, surround yourself with good people. All of these are something that we can do. These are the psychological factors that I was talking about before. So maybe it's not easy for a person to suddenly value themselves. So one of the ways in which you can start doing that is by thinking, being mindful of the situation, staying positive. We'll be doing some exercise on that later on. Do something you enjoy once in a while, set realistic goals, learn new skills, do some creative art therapy, or any type of hobby that you would like to pick up. Self kindness, praying, medication, and gratitude. These are simple things that you can do, and I'm sure many of us are very familiar with this, and many of us are practicing this every day. So I used to say, when you for mental health, so when you want to lose weight, what you have to do is you have to go to the gym, and then you have to be consistent for some time. You can't go to the gym one day and expect yourself to lose weight. Just like that, mental health practices, these little things, in order for them to be effective, you cannot do them one day. You cannot pray one day and expect to be suddenly become spiritual. You have to do it consistently. So just like physical health, this goes the same way for mental health. So now I want to talk a little bit about stress, because among the many mental health problems that we talked about, stress is something that all of us have experienced in our everyday lives. So I want to talk about this, and then tell you the simple ways in which you could uh, overcome stressful situations, or when you are hooked by stressful situations. So first of all, let's talk a little bit about the concept of stress. Stress can be described as the pattern of responses an organism makes to stimulus event that disturbs the equilibrium and exceeds a person's ability to cope. So Hans Selye, the father of modern stress research, he defines stress as the non-specific response of the body to any demand. So non-specific response of the body, it's talking about the body. So in stressful situation, that means any demand that comes from outside, the way the body reacts to it. And it could be non-specific, it could be in a variety of ways. So it's a natural human response that prompts us to address challenges and threats in our lives. And it is very important, actually. So when we are stressed, what happens is a lot of stress hormones are released in the body, and this is for our survival. So it is supposed to help us deal with the stressful situations. So our heart beats faster when we are stressed. Blood is pumped faster in different parts of the body. Oxygen is pumped faster in different parts of the body, so that different parts of the body can have energy to deal with that stressful situations. So when we talk about stress, it's not just physical stimulus, but it can also be negative thinking, or you were extremely stressed uh, with the deadline that you have to meet for tomorrow. So any type of stress that is put on the body, and our response to that. So these stress hormones are released in the body so that you can respond effectively to the stressful situations. So all challenges, problems, and difficult circumstances put us to stress. And I think we have experienced stress every day, almost every day in our life. All of us must have experienced stress. So if they are handled properly, it increases our survival rate. It gives us energy. It pushes us to move forward, isn't it? So for me also, in order to be extremely productive, there has to be something that pushes me to be productive. So it increases human arousal and affects performance. But however, if the stress is too high, it can cause damage to the body. So the type of stress that is good for you, uh, and it is one of a person's best asset for achieving peak performance and managing minor crisis, is what we call the eustress. We have two types of stress, and the other one that is called distress. Distress is the manifestation of stress that causes our bodies wear and tear. So, stressful situations, you are supposed to deal with it. Your body is equipped to deal with it. But in those situations when the stress has become chronic over a long period of time, and you're not really doing anything about it, or if you are doing something about it, but there's nothing that makes it better in terms of coping, then it has moved to distress. So while we experience stress daily, we often only notice or identify stress when our perception starts to exceed our resources for coping. So what stresses you out might not be what stresses me out. So uh, there is a lot of individual differences on how we perceive stress. And when we start to see things as exceeding our resources for coping, and when we feel that, okay, this is going to be too much, I'm not going to be able to manage it, only then it became stress. So not every stressful situation becomes stressful for everyone. So it's our way of coping with it or dealing with the situation that makes it stressful. So when daily stresses begin to pile up and we can't cope, they turn into cumulative stress. And this can be extremely detrimental, not just to mental health as well as physical health. So, our body's response to a stressful situation is directly linked to health outcome, in the sense that when the body moves to chronic stress, every time a person is stressed, stress hormones are released in the body. So when these are not put into effective use, and when a person has been under chronic stress for a long period of time, then the body does not know how to turn off the stress response. And therefore, these hormones are released over and over again in the body, which ultimately leads to compromisation of physical health in the body. So there's a direct link between stress and physical health as well. So just few simple tips that I wanted to show you, which is extremely simple. Uh, so let me explain the context to you. So when we are stressed, these powerful thoughts and feelings, although they are natural part of stress, uh, the problem, as I have said, it's how we perceive it. So problems can occur when we get hooked by them, when we get hooked by these feelings. So you know that when something is on a hook, as we see in the picture, it cannot get away. The hook traps it. So sometimes we are also trapped and we get hooked by these stressful situations. So one moment you might be enjoying sharing a meal, and suddenly the next moment you you remember the angry thoughts and feelings that maybe the fight that you recently had with someone or maybe your husband, and then uh, you suddenly get hooked with the feeling. You A few minutes ago you were very happy having dinner with your family, and then suddenly you get hooked by that feeling, and you may feel as if you are being pulled away by anger, even if you are still there, right? So these difficult thoughts and feelings hook us and pull us away from our values. So what do you mean by values? Values are our deepest desire for the sort of person that we want to be. So I am a mother. So as a mother, my value is that I want to be a loving mother. I want to be committed. I want to be present with my children. So that's the type of mother that I want to be. So values describe the sort of person that you want to be, how you want to treat yourself and others and the world around you. And values are extremely important to a person. It's how we identify ourselves as a person. But in stressful situations, these difficult thoughts and feelings, they hook us. in such a way that we are pulled away from these values. So, as a mother, I want to be a very present mother. I want to be an understanding mother. I want to be a calm mother. But sometimes when I'm under extreme stress, even if it's not the fault of my children, I end up scolding them sometimes, creating, uh, causing them to cry, causing them to have bad moods, you know. So these stressful situations, if we are hooked by them, then easily you move away from your values. So it could be because of different things. Many things can hook us. It may be a feeling of giving up, thinking it's all too hard, thought about blaming others, maybe harsh judgment about yourself, maybe memories about difficult events that has happened in the past, uh, or it could even be thoughts about the future, what we fear, how will I take care of my family. So there are many kinds of difficult thoughts and feelings that can hook us. Uh, so when we get hooked, our behavior changes. We often start doing things that makes our lives worse. We call these behaviors away moves. So because when we act like this, we are moving away from our values. So that's why we call it away moves. So one of the ways in which you can deal with that is to learn to be more engaged and focus better. Then you will be able to handle stress better. So if you do that, you will find your relationship with others more satisfying. You will be able to do important things much better. So one of the ways in which you can practice that is you could practice while talking to family or friends. Notice that try to notice what other people are saying, their tone of voice. There might be something that's making you extremely stressed at the moment, but since you cannot do anything about it, rather you give your full attention to the things that matters around you. It could be playing with your kids, giving time to your kids. You're having a deadline, you have a few hours left only, so you might be saying, how on earth can I give time to my kids when I have to do this? But then there was not there, and if there isn't really anything that you can do at that moment, maybe you can just enjoy that little activity for a few minutes with your kids, and that is going to be able to unhook you from from the stressful situation. You could practice this while washing, cooking, or doing chores. You simply give your full attention to the activities, and whenever you notice you get hooked, try to be engaged in the situation around you. If you're drinking a cup of tea, try to enjoy that cup of tea with full attention on that particular thing. You know, because this concept comes from what we used to say. If you ask someone to not say, now I'm asking you, do not think of an elephant. Many of you might start thinking about an elephant, isn't it? So, human beings, we tend to do exactly what we are told not to do. So, rather than trying to forget the stressful situation, if you learn to engage yourself in other situations that is surrounding you, other the people that you love, then that is going to help you unhook yourself from the situation. But of course, sometimes feelings and stories are extremely painful. They are so overpowering that they turn into emotional storms, right? And you can't always uh, engage yourself out of it. But uh, some even though it is extremely difficult, this emotional storm means that you experience them intensely. You experience difficult thoughts and feelings intensely. They are so strong that they are like mighty storm, and they can easily overpower you. So when an emotional storm appears, we must learn to ground ourselves. So again, what does that mean? Grounding ourselves means that, again, it means engaging yourself in the situation. So it's by engaging with the world around you and focusing on what you are doing. So the first step is to notice how you are feeling and what you are thinking. So grounding does not make the emotional storms disappear. It just keeps you safe until it's over. So the purpose of unhooking and grounding is not is to help you engage in life. So basically, if you learn to engage yourself in life and give full attention to family and friends during a storm also, it will help you to move towards your values, to help you behave more like the kind of person that you want to be. And of course, that is not That does not mean these unhooking and grounding exercise will get rid of difficult thoughts and feelings. They will continue to be there, but that is not the purpose. The main purpose is, even in situations like this, if you learn to engage and ground yourself with the people around you, then it's going to help you focus on what you are doing, and so that you can do it well. So when you pay attention and engage fully in any activity, that you may also find it more satisfying. And this is true even with activities that are boring and frustrating. You know, sometimes when I'm extremely busy and I have piles of things that I need to do, and my children are asking time from me, especially these days, my younger one is fully attached to me. So every now and then she would call me and ask me to play with her. So sometimes I would say, I don't have time, I have to do this. But just as I'm teaching you now, I have learned to give at least 10 minutes of my time to her, and children, they get satisfied very easily. So when I give her full 10 minutes without thinking about the things that I have to do, but rather, like sometimes last night she showed me, she cut off clothes and she showed me, and she explained them to me. So they were just small clothes, nothing interesting, nothing fancy, but I engaged in the moment, and I played with her. I played along with her, and I was the one who ended up really enjoying the play with her. She had a good time, I had a good time. So that is what engaging and grounding exercise is trying to help you to do. So that is one way of coping with stressful situations. So sometimes things in life, you can't always solve them, you can't always deal with them. So if we learn to cope with them, then that is the first step for mental health outcome. So one more thing I want to talk about, one more tip is, uh, so when you are feeling stressed, try to take these steps. First of all, you realize when it's causing you a problem. Are you having sleepless nights? Are you having headaches? Are you overtired? Are you physically exhausted? So try to realize these signs and be patient and gentle with yourself. So when you finally know the cause, you try to identify the causes, the underlying causes, and try to group them into three things. So group the possible reason for your stress into those with a practical solution, those that will get better anyway given time, and those you can't do anything about. In three ways more: those with a practical solution, those that will get better anyway given time, and those you cannot do anything about. And usually our stressful situations falls under these three. So try to let go of those in the second and the third. Those are those that will get better in time, and those you can't do anything about. So there's no point in worrying about things you can't change, or things that will sort themselves out, isn't it? So when you group them like that and the practical solutions, then you can do something about them. And also, it is always important to review our lifestyle. Are we taking on too much? Are we trying to do everything? Or are we not doing what we are supposed to do? These can also be a cause of immense stress. Are there things that you are doing which could be handed over to someone else? Could you do things in a more leisurely manner? You may need to prioritize things that you are trying to achieve and reorganize your life, so that you are not trying to do everything all at once. All right. So when dealing with stress, it is important to deal with your physical, mental, and social well-being. Physically, one should maintain one's health and learn to relax if one finds one under stress. That is extremely important. And mentally, it is also important to think positive thoughts, value oneself, demonstrate good time management, plan and think ahead, and express emotions. Socially, one should communicate with people and seek new activities. As I have said in the beginning, research have shown that one of the major contributing factor for mental health is social connections. So that is also extremely important. So the activity, we are not actually, it might not be possible for us to actually do the activity, but I want to teach you a little bit on how to reframe thoughts. So the name of the activity is reframing negative thoughts. We still have about half an hour, so that should be more than enough. Okay. So, what do you mean by reframing negative thoughts? Reframing negative thoughts is the process of turning our original thought into a more realistic thought, almost like viewing it from an outside perspective. So, by changing our negative thought, we can avoid some of the negative emotions that come with the original negative thought. So, I think many of us are guilty of negative thoughts, and some people are especially prone to having negative thoughts. In psychology, we used to say that every thoughts and actions have a pathway in the brain, and I'm sure people from science are familiar with that. So we have neuronal pathway where every actions are formed. Even you were younger, you if you were asked to brush your teeth, you were not able to do it properly, right? When you were 1 year old, you were not able to do it yourself. But if uh, now at this age, brushing teeth is so easy that it comes very automatic to you, right? So it becomes so automatic to you that you are not even aware of brushing your teeth while you're doing it. So the pathway for brushing your teeth has been paved so clearly in your brain that it becomes very automatic to you. So negative thoughts also, if you are the type of person who tends to think of things very negatively, always looking at the bad in things, in situations, then that pathway becomes more automatic than positive thought. Therefore, sometimes it it is effective to reframe negative thoughts. Of course, sometimes in a lot of psychological disorders, especially the severe ones, positive thinking alone is not going to help. But for general mental health, it plays a very important role in the sense that you need to have that pathway framed in your brain. That's the main underlying idea behind reframing negative thoughts. So, I want to talk about four types of negative thoughts that we are usually guilty of as human beings. First is taking it personally, that is blaming yourself or taking someone else's comments as a personal attack. You must be familiar with people who tend to take things very personally. People say one thing and you start thinking, okay, he targets me. Maybe he's trying to, like humiliate me. So that's one example. Next is blame game, blaming someone else for your actions and mistakes. And the next is negative overload, exaggerating the negative side of things, as I was talking about. Next is black and white, only seeing the bad in a situation, like not seeing things as a continuum, rather as yes or no, and seeing the black in a situation. Under blame game, also, there are some people who tend to blame others for situations that are not going their way, right? So we have, I think, many of us are guilty of at least one of these negative thoughts. So let's try to look at ourselves and do some self analysis and see if we are guilty of these negative thoughts, and we'll try to see how we can reframe them. Okay. Okay. So, four steps to overcoming negative thought patterns. The first is to identify, we have to accept that we have these negative thoughts, right? And then if we can, try to determine what type of negative thought am I having. Am I having a blame game, or am I having taking things personally type of negative thought? So we can do that analysis and then try to view it as an outsider, getting a realistic perspective. Why an outsider? Because if we look at ourselves, it is very easy to be in denial. Even if we know that we are guilty of a thought, a negative thought, we almost always refuse to accept it and accept that it is our thought, right? So human beings, we have that tendency. But if we learn to look at it as an outsider and fully accept that I am okay, responsible for this thought, I'm guilty of this thought, that it would make it easier to have a realistic perspective. And then once you realize that, you start reframing the thought in a more positive manner. So let's take a look at some exercise. We're almost done with the presentation. Okay, can I Let me just look at the chat from here. Um, okay, I have the chat box with me. Can anyone give me one example of taking it personally? You can maybe share it in the chat box. Okay, all right. So let's try to do that in the end. All right. We still have a lot of time, so I'm thinking if we can have some discussion, but all right, fine. Okay, so let's look at these examples. Number one, taking it personally. So as I have said, it's blaming yourself or taking someone else's comments as a personal attack. So I am sure we are all guilty of that. So one example of how we do that is, let's take a look. My student says she hates class. It must be my fault. Maybe I'm not very good as a teacher. So you're taking the fact that your student doesn't like class, you're taking it as a personal attack, right? So that is very easy to do. So how do you, first of all, what do? You first say, okay, what I'm thinking of right now, is it a negative thought? Yes, it is. What type of negative thought is it? I think I'm taking things way too personally. So how do I view it as an outsider? I think like, oh, okay, I think I'm taking it personally, as much as I hate to admit that, but maybe I am wrong. So let me try to reframe this in a positive manner, right? So one of the ways in which you can do that is, this student must have had a bad experience. I can try to make him or her like class better by maybe through the way that, maybe through effective teaching and more effective teaching. So there are many other examples that can take that can be given regarding taking it personally, and I'm sure the participants can relate to this. So if we learn to reframe the ways that we usually frame our sentences in our head, then it becomes more easier to think of things positively. Let's look at the second one, blame game. Blaming someone else for your actions and mistakes. I think that I'm also sometimes responsible for this. So an example of that, all of my students fail the test, it is because they are simply stupid, nothing else. So maybe you can reframe that. Maybe that is true. Maybe some ways that you're thinking is true, but that does not mean that it is healthy to have a thought like that. So maybe you can reframe it like, I must not have taught the content well enough. How can I help my students to do better on the next test? So that is a good reframing of the negative thought. The next, negative overload, exaggerating the negative side of a situation. So, over exaggerating a situation, thinking of it negatively. The head teacher's evaluation said that I should speak louder when teaching. I think it's more because she targets everything that I am saying. She thinks I am such a bad teacher because I talk soft. So, how do you reframe that? I am so pleased to receive such feedback, and I will try to speak louder so my students can hear what I'm saying better. So, when we talk about reframing, maybe you don't, in this example, if we look at it, maybe you're not pleased to receive such feedback, but you stop telling your brain that you don't like receiving such feedback, right? Rather, you change the way that your brain thinks. As I have said in the beginning, the relationship between the brain and behavior is reciprocal. Reciprocal in the sense, these thoughts they come to you as a stimulus, and then you start interpreting them, and the way you interpret them is going to lead to a lot of physiological changes in the body. So therefore you can do something about it, that means. So even if you are not entirely happy to receive such feedback, if you tell yourselves that, then automatically that changes are going to happen in the body. So maybe I will try to speak louder so my students can hear what I'm saying better. Okay, maybe you don't accept it. Don't dwell so long in that situation. You just make a good, you reframe it positively and you try to walk away from that thought. The next one is black and white, only seeing the bad in a situation. So an example here could be, student evaluation said that they liked my teaching but did not like my class. So my students do not like coming to class. So that can be reframed by the students are enjoying learning, but they also like to stay home. So when we talk about reframing negative thoughts, they are simple ways uh, of for achieving a very mentally healthy lifestyle. So mental health, they can start in simple ways. Some people, because of physical illness, because of physical vulnerability, or many other things, uh, they can develop severe mental illnesses. So in those cases, as I have said, they have to be treated medically. They have to also take psychotherapy, depending on the type of disorders. But in general, everyday life, so many of us, although we do not have these severe mental disorders, but we are neither mentally healthy. So why? Because a lot of it is because of the way that we think, our thoughts, the way that our thoughts are made in our brain. So we are 100% responsible for the things that we think about. So therefore, when you learn to reframe these negative thoughts into positive thoughts, or when you learn to engage and ground yourself in situations, when you learn to group stressful situations into different categories and learn to deal with the things that you can deal with, and try to let go of the things that you do not. These are simple ways in which you can establish a more mentally healthy lifestyle. So these are extremely simple steps, but they are extremely effective. And as I have said in the beginning, in order to be physically healthy, you have to change your diet, you have to take exercise. And if you eat healthy for one day and if you take exercise for only one day, that's not going to help, right? So in order to lose weight, you have to be take exercise for a long period of time. So just like that, mental health and all these mental skills, also you have to integrate them into your lives. You have to practice them every day for them to be effective. So even with this reframing of negative thoughts, it might not be very easy in the beginning, your mind because your mind has been so used to negative thoughts. And even for the ones who are not necessarily negative, sometimes we tend to have negative explanations of things, right? We are all guilty of that. So, in those situations, since they have become more automatic to us, in order to change that pathway, uh, if sometimes you have to tell yourself the things that you don't believe in, and all the thoughts that comes to you, you don't have to believe those thoughts either. So in we used to call them automatic negative thoughts, ants. So in mental health treatment, these ants are very detrimental in mental health outcome. So therefore, in order to fight them, one of the ways in which you can do that is uh, try uh, try to change the way you narrate things, and you don't believe everything that comes to your mind. If something negative comes to your mind and you dwell upon that thought, then you will become more negative. So because of that, do not believe everything that comes to your mind. Rather, you analyze it, you try to figure out what they are, where they come from, and then have a realistic view of it, and then uh, try to deal with it, maybe through reframing the negative thoughts. So, as I have said, we have to make mental health a priority because it leads to overall quality of life. And when we are not mentally healthy, it affects every aspect of our life. So, in the Bible, it was said that Jesus came so that we may have life and that we have an abundant life. So when we talk about abundant life, uh, we're looking at life in abundance. So in order to attain that, it cannot be attained just by physical health. Mental health also has to be there. So we have to make mental health a priority. And as teachers, dear participants, your job is to fill your own cup so it overflows. Then you can serve others joyfully. So that is all for my presentation. Thank you very much. If there is question, then I'll take them. We still have more than 15 minutes, so I think we have uh, ample of time for question and answer session. So if you have any question, you can share them in the chat box. So one question, how do I deal with family problems and simultaneously pursue a career without any problem? So there must be many ways in which you can do that. I don't know you personally, but uh, so pursue a career without any problem. Conflict resolution, you talk to your family about it. See, these are there could be many things that you can do regarding this. There is no way in which you mental health and stress interventions are not necessarily to throw away problems, but rather learning to deal with these problems in life. Right. So I think one of the good ways in which you can do that is talk to your family about it, come to a middle ground where you can agree with whatever situations, whatever problems that you are having. How to satisfy the student ego? I don't know if that's a good thing to satisfy. Should we be satisfying student ego? I don't know. Oh, sir, I was just answering some of the questions
Yeah,
in the
yeah.
chat
Don't
box.
take your time, ma'am.
Mm, I don't know exactly what the question meant, how to satisfy the student ego. Uh, so I don't really know how to answer that. What role does our ego play when we take everything personally or blame others? So we have ego and superego according to Freud. So I think it has a lot to do with our ego, or maybe it's because of our defense mechanism also. It could be anything depending on the type of person that you are. So when we take things too personally, it usually comes from a very defensive way of thinking. Maybe we have been maybe it's because we don't really like ourselves that much and we are being defensive of what others are saying, and we are actually accepting the situation, but we are in denial. So that could also be the reason, or maybe it's because we are plainly not agreeing with uh, what others are saying. So it could be any of that. So how do we avoid people at workplace or home who are very negative and affect our productivity? So yeah, I think this is a very important question in the sense that so it is very important to prioritize our mental health. So one of the ways in which you can do that is walk away from negativity. So simply you don't involve yourself in such negative interaction. That would be one way to do it. But practically speaking, sometimes you want to be in good terms with others as well, but the person that you want to be in good terms with could also be negative, right? So in those situations, conflict resolutions, how do you come to the middle ground? How do you learn to say no, be assertive to this person, but at the same time not offending them? That is a skill that needs to be mastered by all of us. So but mental health is always a priority. So you should always prioritize your mental health, walk away from negative situations. Statement, it might happen that the person can go in guilt that it's because of me only. So how to get in the example for blame game, while reframing the statement, it might happen that the person can go in guilt that it's because of me only. So how to tackle that? What was the example we had? Let me take a look. Blame game, so we said blaming someone else for your actions. Hmm. Yeah, guilt can also play a role there. So if someone feels guilty, that does not necessarily mean that they are blaming that person. So I don't think that's necessarily a bad thing. I don't understand the question exactly. Oh, okay. So I don't know if I answered that question. I didn't know understand the question exactly. I'm so sorry. You can ask me more question later on. Um, how social media impact college students and their social behavior. We know that it impacted everyone, even children, adults, college students, in many ways that we can count. I don't know if I can answer all those in this session. Mm, uh, How I can manage negative thoughts among my students that job opportunities has now restricted in general. Cause some negative thoughts are realistic thoughts sometimes. So we have to learn to differentiate between reality, negative positivity also. That's why I mentioned that not positivity is not always the answer to things. So we know there are a lot of job restrictions now these days everywhere in India, right? And our students are also demotivated in some way because of that. But one of the ways in which you can curb with that is you can encourage them, make them work harder so that they can actually earn these jobs that are very scarce these days. So these are not just normal negative thoughts. These are not just what do we call it? Unnecessary negative thoughts, but they are realistic negative thoughts. So in those cases, we have to learn to deal with them realistically as well, right? So you can't always positively think your way out of things in every situation. Sometimes we have to learn how to deal with situations uh, on the face. So that is also important. Okay, so many times we have seen good in every situation, but in somehow what felt sad. So, okay, I did not understand this question. How do we get rid of that? Get rid of, but in some. So I don't know exactly what the question meant, but if you're meaning to say that we have seen many good in situations, but sometimes we feel sad, I think that's human nature. So we're not always supposed to be happy. These ups and downs makes us what we are as human beings, and that it makes us special as human beings. So I think why would you like? There's no reason to always want to be happy. These challenges are actually the ones that makes us who we are. So I think they are wonderful. So we can't always be happy as human beings. We can't always be sad as human beings. I think that's just the way we are. So yeah, so with that, I think I have answered most of the questions. Some questions I have not answered because there are some typos on the questions and I did not get them. And also, I could not understand them. I'm so sorry. But I hope you have gained from this session, and I hope we all become more mentally healthy in the future. Thank you so much.
Thank you so much, ma'am, for giving us your time. And I think that you make it very engaging because participants have so much of question. And I'm very
Mm.
happy that you can make it possible. This my humble request. Thank you so much, ma'am. And I hope that this type of program will come again and we will keep on engaging your service.
Mm.
Have a nice day, ma'am.
Thank you so much for having me. Take care. Bye
Okay.
bye.
Bye bye. So, dear participant, we will be having lunch break and come back at 1:30. Okay. Have a nice lunch break, everyone.